Assalamu alaikum wa rahmatullahi wa barakatuh. First of all, I'm Dr. Suhair Khan. I'm the head of Department of Quality and Patient Safety Security Forces, Specialized Comprehensive Clinic, Jeddah, Saudi Arabia. I decided to make a project which I really face as a senior dentist, not even as a head of quality. I'd like to share everyone. The most critical part of dental department that it is far away from all the doctors. We have to do the plan, we have to implement, and we have to do everything. There is no team cooperation, actually. Even the head of the dental, usually very far away from our scope. This example, I make it from my own mind. It's a 35-year-old, came to the dental clinic, complaining of pain, and she was treated by one of the interns. The interns didn't extract the proper tooth, so she come to complain that her tooth, the tooth extracted was not the proper one, and she still have the pain. As an immediate action, first of all, the head of dental department with the intern program officer and the quality were called to calm down the angry patient. First of all, you have to give sympathy for the patients and acknowledge his feeling. Then compensate his loss, even though it is just a tooth, but you have to compensate an organ, part of the organs that was lost from the patient. So the head of the department decided to compensate her with a free bridge and implant replacement for the wrongly extracted tooth and transfer her to a consultant clinic to make her painful infected tooth with a root canal treatment procedures. She agreed and cooled down. So they start to schedule her in the consultant clinic. Number two, quality department were informed by an OVR. So the team were formed to check what was the problem and the main causes for the intern to take such a wrong, unforgivable, actually, mistake. Root cause analysis were conducted. First step to make, of course, my project will be root cause analysis. The first part was to make the flowchart explanation to how the process of dental procedures is actually happen in our clinic. The patients walk in, then the history should be taken regarding his medical problem, blood pressure, sugar, pregnancy, heart problem. These are the mainly 4 questions should be asked, and if he have any hemolytic disease. In this case, our intern took the history well, oral examined the patient, the patient's mouth, I mean, but he didn't take an X-ray for the patient. So there is a fault in his procedures. Second of all, he didn't make any patient's consent. He decided to extract the tooth without taking X-ray or without discussing the patient. Perhaps if he discussed the treatment plan with the patient, he would tell him, no, sir, this is not the painful, the other one is the painful. But he jumped immediately. He couldn't find the supervisor around. So immediately he's rushing out of time because of the curriculum and the requirement for his internship graduation. Immediately he give anesthesia and make the extractions, and he write the EMR. Of course, that was an incomplete EMR. Now, let us start to focus by doing the fishbone diagram. What was the main cause for his defect, or from where did he got the cause of the problem? If we start with the people, the supervisor were not around. He was busy with his schedule with 10 or more interns. And the intern himself was not interested about knowing the proper procedures. No X-ray training. He didn't get any training, and he lack of interest of get trained by X-ray. Some of the interns, especially the female, are afraid from the radiation hazard. In our clinic, sometimes we do the X-ray locally in the clinic. So there is a sort or a degree of radiation hazard which most of the female interns and doctors refuse to take it. There is a poor interrelation communications between him and the supervisor. He's afraid that if he said anything wrong, the supervisors will give him a low score evaluation. Sometimes the patient resists to sign a consent, or the poor supervision intern communication. Sometimes there is a crowded clinic that there is no time to take all these investigations for the patients. So he is just rushing and canceling the time for the X-ray and the consent. If we go to the policy, there is no EMR review. The head of dental department did not review the EMR to check are all the interns and the staff are following the policy and procedure or no. The clinical policy and procedures, it's not clearly mentioned and specified that you have to take X-ray, you have to take consent and spend time with the patients to try to educate him and to give him all the optional treatment. If we talk to the place, there is a crowding treatment program. As I said before, more than 10 per supervisor. And the distribution of clinic. The ward is very big, or the dental department is very big, that each clinic is far away and there is like a waiting area between each 2 or 3. So the supervisor really have to rush to cover all the patients. It's not like a cubic. Like in our
دكتورة سهير قدامنا بس معلش كمان 3 minutes ماشي؟
ماشي. For the provision, complications, X-ray machine, and there is no supervisor. And for the process, there is no competency to the flow chart. We can jump now to the 5 whys. Also, yes, 5 whys was done to drill down the causes. I took 2 causes with my intern. He didn't make any X-ray because the X-ray was not taken. Why? Because the X-ray was not taken. And there is no training for the X-ray. A supervisor was not around because he was busy with another supervisor. The intern program allocate 10 interns per supervisor. Next problem was the patient didn't sign the consent. The formula was not around and the intern was not aware of it. And the patient is not aware of the treatment plan. He don't know which tooth to be extracted. No instruction was given, neither to the intern nor to the patient. And the busy supervisor schedule, as we said before, is the main reason. There was no direct observations and consultations with the supervisors. So to understand the process and to know the area of defect, we brainstormed all the possible causes and we decided few actions to control this problem. First of all, we have to reduce the number of interns. Not maximum of 5 per supervisor should be there, and we allocated time for that from 2 weeks starting from 1/12/2021, and this should be done by the interns program officers and followed up by the head of dental. And then as we said, increase also the patient the intern supervisor ratio. Head of the department will do it. Okay, and then we have to oblige the intern discussion and treatment plan with the patient. He have to make the consent and he have to be sure that he will take time explaining the treatment plan to the patient. And this is the responsibility of course, the intern, but under the supervision of the supervisors and intern under the supervision of the supervisors, and the head of dental department to check, and this will take 1 month. And then he have the quality professional and the head of dental have to give more lecture about the clinical policy and the flow chart and the importance of compliance to it. And the medical director should follow this. And then there should be a mutual trust and fearless atmosphere and safety atmosphere between the interns and the supervisors. As we said before, head of dental department should be aware of that, and the quality with the medical director should follow up. Thank you so much. Thank you.
Thank you, Dr. Suhair. Okay, I think we وفلفل كل الكرايتيريا اللي المفروض نمشي عليها في حالات الار سي. well done.
Thank you, Dr.
Thank you.
Nice to see you and to see Dr. Ahmed, and thank you for all the groups, especially Dr. Rashid. Thank you very much.
يلا مستني ايه؟ قوم دلوقتي وكلمنا على الأرقام اللي ظاهرة على الشاشة أو تواصل معانا من خلال الويب سايت. Advance your career with IMETS Academy.